Hi everyone, it's Andrea Tooley from AndreaTooley.com. Thank you so much for watching this video today. I'm sorry I've been kind of sporadic with the videos. I'm really trying to do every Monday, but occasionally with call, traveling, holidays, things like that, I might miss a Monday here and there. So don't forget to subscribe to this channel so that when I do post a new video, you'll be alerted and you won't miss it. And I'll try to keep bringing great content for you. My goal is to have interviews with people in all different fields of healthcare, answer all your questions about medicine, and kind of bring more awareness about medicine and all the different opportunities for different professions within the field to all of you guys out there. So I hope you're liking these videos. Thanks for watching. So today, I wanted to talk about third year of medical school. So that would be in America. If you're in a U.S. medical system, our third year is a clinical year where you rotate through different clinical subspecialties. And it's a really important year. Your grades are really important. The feedback that you get from your attending physicians is very important. And that's where you kind of meet mentors, cultivate some of your letter writers when you're applying to residency, and the feedback that you get from those clinical rotations matters when you're applying to residency because it really speaks to how you'll be as a resident. And it's kind of your first time outside the classroom, getting involved in patient care, being part of a healthcare team, and really working as a medical student outside of the library and outside of your textbooks. So it's just an amazing year. It was my favorite year of all of medical school for sure. Third year is just the greatest. But it's definitely a transition, and it's very different than first and second year. So I've had a lot of people ask me questions about what are your tips for third year? How do you succeed as a third year? And so I thought I would kind of share some of the things that I did when I was in medical school. And now that I'm a resident, kind of looking back on it and seeing how I view the medical students now that I'm in the resident role and things that I think make an outstanding medical student as a resident. So that's kind of the plan for the day. Basically, third year, kind of like I said, you rotate through all the different subspecialties of medicine. And every medical school is set up a little differently. But my third year, I did internal medicine in the hospital and outpatient. I did neurology, psychology, family medicine, pediatrics, both in the hospital and outpatient. I did surgery, surgical subspecialty, which I chose ophthalmology because we could kind of choose what we wanted to do. And obviously I was interested in ophthalmology, so I wanted to do that. And OBGYN, those were kind of our big subspecialties as the third year. And what you do as a third year medical student is you're part of that team. And generally a team at a teaching institution will involve medical students, both third years and fourth years, interns, which are first year residents, and then upper level residents, so second or third year residents, chief residents, sometimes fellows, depending on what kind of service you're on, you might have fellows, and then your attending physician. There's also pharmacists, speech language pathologists, occupational therapists, physical therapists, all kinds of other members who make up this big team, which will ultimately help with patient care. So your role as a third year medical student is kind of difficult to figure out right away because you're not a physician. You can't prescribe medication. Some hospitals will let you put in orders, but other hospitals you can't put in any orders. And so you're kind of in this weird space where you're thinking, what's my role? What do I do? How can I help and be useful? And how can I also learn? And so I think that's the challenge. So one of the best things I think you can do to start off when you're new on a rotation and when you're a new third year is to, first of all, ask your residents, ask the interns, the first year residents, and then ask your upper level residents what they want from you. Say, what can I do to help you? What would be good as a role for me? What do you think would be good goals for me to have for this rotation? Because number one, they're going to appreciate that you're asking how you can help. And number two, they might have really good insight, like, oh, this would be great if you could do X, Y, and Z. Or I think that these would be really appropriate goals for you to have during this rotation. Then, after you kind of have a feel from the residents about what kinds of things you can do to contribute to the team, you can start doing those things. So, generally, as a third year, if you're on a regular medicine service or an inpatient hospital service, you'll be given one or two patients, and those will be your patients. a lot of times those will be new admission patients, and so it will be your job to go do the admission. So you go see the patient, take a full history, find out everything you can about the patient. I used to try to read through the entire medical record, just read through everything so that you know everything. Because if you think about it, the interns and the other residents, they have 5, 6, 7, 8, 9, maybe more patients of their own. And you as a third year have 1 or 2 patients. And so you, as the third year, should know more about that patient than anyone on the team. You should know everything. You should know how many pets they have at home and what they like to do in their spare time. You should know their medical history and what kind of surgeries they've had. You should know what medications they're on. You need to know that patient forward and backward, inside and out. And that patient needs to know you and know that you are the medical student working for them. And so tell the patient, I'm the medical student on the team. I'm going to be helping to take care of you. I want to chat with you and get to know you. What can I do for you? If you need anything, just let me know. And you can advocate for that patient, because the more you invest in the patient and the more you feel like that patient is your patient, the more you're going to get out of the rotation, the more you're going to learn, and just the more enjoyable it will be, because you'll really feel invested. The best feeling is when you don't want to miss a day at work because you feel like your patient needs you. And you don't want to be late because you think, well, I need to be there because I know what's going on with this patient and I need to relay that to the team. Because if you just feel like it doesn't matter if I'm here or not, then it sucks going in there because you can't really put in orders, you can't do things. So if you feel like no one would notice if I wasn't here, then you're not going to be having a good time. So make yourself invaluable to the team by knowing everything about that patient, okay? So after you've really researched your patient and you know everything there is to know about the patient, you'll write your note. Try to write a great note. You know, you want to do the best you can do because you're going to have more time than everybody else on the team because you only have these 1 or 2 patients, whereas everybody else has tons of patients. And so write a good note. Try to make a plan. Say, I think we should probably do X, Y, and Z. Look up on UpToDate, which is a great website that you'll have through your university, or look up online what the plan is. Say the patient has a COPD exacerbation. You need to look up online what the guidelines are for COPD exacerbations and say, I think we should do X, Y, and Z. You making a plan and telling your resident is great because it shows that you're trying, you're thinking, they're going to really appreciate your input. And even if you're totally wrong, it doesn't matter because you're not going to be putting in those orders or doing those things, so you can't hurt the patient, but you're making an effort and you're learning because you'll always remember, oh yeah, I suggested that we do this and really that wasn't the best idea and we ended up doing this. And then you'll remember that and it'll help you learn more in the future. Okay, so those are the things you want to do for your patient. Then, when you're rounding with the whole team, you're going to be in charge of presenting that patient. So saying, this is Mr. So-and-so, he's an 89-year-old male with coronary artery disease, hypertension, hyperlipidemia, a past myocardial infarction with a stent, and da-da-da-da-da, and, you know, saying everything about them. And so you want to give a good presentation. You want to know the plan, because the worst is when you're saying, today we're doing X, Y, and Z, and then your resident says, oh, no, we're not. We're not doing any of that. You want to, which happens because there's so much going on between the teams and you might not always be involved in all the conversations, which is one of the struggles about being a medical student is that you don't carry the pager, and so sometimes you miss things. So always check in with your upper level resident. Before you present a patient when you're on rounds, say, I just want to make sure that this is the plan. And I just want to make sure that I'm on board and I know what's going on. Okay, so those are things you can do to make sure that you know, because it can be frustrating when you feel like, oh, they totally changed the plan and nobody told me. But the residents have so many things going on, and sometimes they're not going to remember to tell you. And so it's your job to check in with the residents and say, did I miss anything? Is anything happening? But another thing that you want to do is try not to miss those things. And so if there's a family meeting, if there's a multidisciplinary care meeting, if there's anything going on involving your patient, you need to be there. You don't want to miss that meeting. Also, in the morning, when the morning resident comes and the night resident is going to leave and they do their handoff, when the night resident is talking about your patient and saying, overnight they had some chest pain, and so we got an EKG, and it actually showed that they were in AFib, and so now they have a Holter monitor on, and we're going to be seeing what's happening with that. You want to know that those things went on, and if you don't get there early enough to be present for that handoff, you're not going to know those things. And you don't want to be the medical student that's coming in later and then asking your resident, oh, can you tell me what happened overnight, when they've already gotten sign out from the night resident. You want to be there first. You want to get sign out from the night resident, and then you want to be the one either telling your resident what happened, because that makes you very helpful, or you want to be present for that conversation so that you're not missing anything. You just want to be one step ahead of the game. If it involves your patient, you want to know and you want to be there, okay? And then other little things you can do to make yourself super useful are just kind of those tasks that are hard to fit in during the day. So when I was on medicine, we had a patient who came from an outside hospital, and they had tons of outside medical records, and it was really difficult to get them into our system and to make sure that we had them all faxed over and there's paperwork, and it was really annoying and something that I didn't want to deal with. And so my medical student took it upon himself to get all those outside records, and it was so great because I knew that he was on top of it, and I knew that he was working on getting the records. So when my staff attending or consultant would say, oh, have we gotten all the medical records? I could say, oh yeah, the medical student's working on it. He's already faxed all the paperwork, and we're just waiting for a response. So those are little things that make you very useful, very appreciative. Your residents will love you for it. So if there's anything like that, any paperwork that needs to be done, anything like that, you just do it. Just be on top of it. You can ask the nurses to help you. You can call anybody and ask them to help you, and people will help you get things done. Because I know when I was a third year, I felt like I didn't want to step on anybody's toes, and I didn't want to do too many things. So I felt nervous about making phone calls. I felt nervous about following up on labs. I remember I had a patient, and we were waiting for some results from the lab. And I felt really uncomfortable calling the lab to say, like, hey, where are these results for this patient? And so I didn't, and then my resident did. But thinking back, I could have, because the worst thing that's going to happen is they say, no, we don't have them, or whatever, or you call the wrong person or whoever. Don't be afraid to just try to help, because nobody's going to fault you for trying. And so you can make phone calls. You can try to do things and just continue touching base with your resident. You don't want to go rogue and like start doing all these things on your own, and then your resident's doing them as well, and then both of you are doing the same thing. So you want to tell your resident, hey, I'm going to try to figure this out, and I'll let you know if I need help. And they'll say, great, let me know, and they'll let you do things, and it'll be fabulous. So those are all ways to just, again, the whole point is to kind of make yourself useful, make yourself part of the team, because you'll have a better time. Your residents will appreciate you more. You'll get a better grade. You'll get great recommendations and evaluations saying that you were hardworking, you took initiative, you were enthusiastic, and all kinds of things like that. So besides just doing the work, you also want to learn and learn the medicine part of things. So the best thing you can do is just read about your patients. So anytime your patient comes in, whatever they have, you want to read everything they have about it. Up to Date is a great source. I read everything on Up to Date. And then I have a couple other sources here that I loved. So one is this book called Pocket Medicine. And I think this is backwards on my video, so I apologize. But this is an amazing book. It fits in the white coat, in your pocket of your white coat. And this is an older version. It's green. I think the newer version now is like purple or red. But you can buy it on Amazon or online or whatever. And what it is this amazing book that literally has everything you'd ever need to know on medicine. And it's all put out in different subjects and different topics. And it has the treatment. It also even will cite the landmark studies that give the evidence that support the treatment that they're writing about. It gives you all the information you need to know about everything. This book is golden, and you could read it a million times, and there'd still be more things that you would get out of it. It's just great. So I would highly recommend getting this book and putting it in your white coat. It's expensive. I remember when I went to buy it, I was like, what? This $50 for this tiny little book or however much it is. But I promise you it's worth it. This is a great book. So definitely pocket medicine, okay? Another book that's great, this is the Maxfield. So this is just a tiny, tiny little thing. But it is so useful, and it also fits in your pocket. I always kept it in my like top pocket here, but it would fit in your lower white coat pocket as well. And so it has so many great things. It has like common EKG rhythms. It has information about heart arrhythmias. It's all like the quick guide, things that you would need to know. This is ACLS about running a code. So I hope you wouldn't have to stop and look at this if somebody was having a code. But if you weren't running the code and you were just part of it, you could read this and follow along, and it'd be very helpful. Also, I love this. They have the NIH stroke scale here, which is something I have to look up every single time. They have normal electrolyte values, how you write out electrolytes. When I was a third year, I didn't know that this was how you write out electrolytes, this little diagram, and this one here too for I guess this is electrolytes and this is blood. But I didn't know how you did that, so that's how you write it out in your notes. And they have normal lab values for everything here, which is also very helpful. More normal values, body fluids. Okay, and then here's the great part. They have note templates. So if you're not using an EMR system that has a template already, it tells you how to write a discharge note, how to write an admission note. But even if you are, it's just all the things you need to think about and you need to ask about. And so it's great that it's all mentioned here. There's even a postpartum note if you're on OB, an operative note. They have APGAR scoring. Here's how to take a history and physical with all the things you need to ask for an initial H&P. I mean, this book literally just has everything you'd ever want. Here's a full neurologic exam with all the different tests you need to do for a neuro exam. So, as you can see, this is something you would 100% want in your white coat because it has everything you'd ever need. Plus, I love that on the back, it has a visual acuity chart with the tumbling ease and a Snellen, as well as a little ruler if you need to measure anything out, which is so great. And I think, oh, it doesn't have pupil size. Some of them even have pupil sizes. But this Maxwell is super useful, so I would definitely keep that in your white coat. Okay. Another thing you for sure want in your white coat is some kind of notebook, something where you can write things down. I love these little tiny notebooks, and I write, oh my goodness, I take so many notes in these things, and I write down everything that I would ever need to know. Recently, like, I've done all kinds of glaucoma stuff, and it's just becomes very high yield and has all the information that I would need to know in here. And so this is a great thing to kind of put in your white coat pocket as well. Always keep a pen with you. Make sure you have a pen. Multiple. I would have like 5 or 6 pens in my pocket because you're always going to lose them. So keep a pen, keep a notebook, so that you can jot down things to look up later or so that you can take notes on your patients. Or just little tidbits that you learn or how to do things. All very useful, okay? So those are things I kept in my pocket. Other things I always kept in my pocket were like snacks, breath mints, chapstick, granola bars, all those kinds of things, plus your stethoscope. And, you know, you always find things to load down your white coat pockets with. But I think that these guys here that I've talked about are a great way to start when you're a new third year. And then you can kind of build on this. And the last thing about third year I wanted to mention would be studying for your exams, because people always ask how you study for your tests. And unfortunately, I've been kind of out of medical school for a long time now. And so I'll have to interview new third years and see how they're all studying. But I made different blog posts for all of my different third year and fourth year rotations, so you can check those all out on my blog. And I put how I studied specifically for each rotation, but for most of them, I used UWorld questions, and I would do the specific questions for that rotation. I also really liked pre-test books because I like questions, and so I would always do the pre-test books. I used a little bit of Mixapp for medicine, but not a lot. I used Pestana for surgery and also the NMS books for my surgery rotation, and I loved those. So if you have tests that you need to study for, you could check out my blog post on my blog. I also always went to studentdoctor.net and would read about how everybody else was studying for those rotations, just to get good tips to see how people were studying and what books they liked best. So I hope this helps you, just give you an overview of third year. It's the best year ever, especially if you just really take ownership and, get into it and be part of the team. Some days when I didn't want to be there and I wanted to be home and I felt like, oh, I can't believe I'm still here, this is worthless, I would just say to myself, I'm going to pretend like this is my patient and there's nobody else here for my patient, and I am going to take care of them. And so if you just tell yourself that like you're the one who has to care for the patient, and pretend like there's no resident there and there's no consultant there, and just tell yourself, if I'm not here, this patient's not going to get the care that they need. And then you'll really feel like you're valuable and you need to be there. And it'll also set you up well for residency, because in just a couple years, you'll be a resident and you really will be the only one there sometimes. And you really will need to know these things. And so I hope you enjoy the year. It's the best year ever. Really have fun, learn a lot, be part of the team, be enthusiastic and excited. Even if you don't like whatever field you're doing, it's one of the only times in your life that you get to deliver a baby, or see someone have an acute psychotic break, or see sepsis or congestive heart failure, all these things that you might never see again. And so it's truly an honor and a privilege. I hope you enjoy it, and I hope you like this video. Thanks. Bye.